Using antibiotics correctly. Antibiotic resistance is one of the most challenging problems in healthcare today. It occurs when bacteria stops the effectiveness of antibiotics. To maintain the effectiveness, they should be used properly. Not all common illnesses are treated by antibiotics. Illnesses such as running nose, cough, muscle aches, and sore throat are caused by viruses, which can be treated by decongestants, cold formulas, and cough syrups. Chronic illnesses such as pneumonia, meningitis, dysentery, and blood poisoning are caused by bacteria. Use antibiotics only when necessary. Using antibiotics too often or lack of completing one's course of antibiotics is improper. It reduces its effectiveness and can lead to antibiotic resistance. Do not self-prescribe. Have a doctor or pharmacist prescribe antibiotics for you and do not take medicine prescribed for others. Antibiotics are prescribed for specific conditions and may not be a best fit for all illnesses or people. Inform your physician of any allergies you have prior to receiving any antibiotics. Prevent infections. During your course of antibiotics, prevent further infections by keeping your hands and food clean. Avoid raw eggs and undercooked meat. Avoid spreading infection to others by staying away from public places. Complete the prescribed course of your antibiotics. Complete the course of antibiotic prescribed by your doctor or pharmacist. Failure to comply may result in a reoccurrence of the bacterial infection. Consult freely with your doctor or pharmacist. Feel free to ask your doctor or pharmacist about potential side effects and contact them immediately serious reactions occur.